I just want to welcome everybody online. Um, as we're going through this whole COVID-19 new environment, a lot of things going on. I know we're doing a lot of webinars on the lending side and how to continue business, but we also feel that it's important that our employers and their employees understand that there are options so that they can also maintain their insurance. This is a program that we started uh, probably about 9 months ago. We developed it for over a year and rolled it out about 9 months ago. So we think it brings value to our business owners, but especially uh, to their employees as an affordable option for health insurance, not only in this time of COVID-19, but also prior and after this. We think it's an affordable plan, and that's what we were working on bringing to our membership is an affordable health plan that met the California requirement for having insurance. So Catherine Gutierrez Schultz administers the program for us through Apogee Healthcare Systems or Health Solutions, which is the company that put it together for us. So with that, I welcome everybody and I turn it over to Catherine. Catherine?
Thank you, Julian, and good afternoon, everyone. As Julian said, my name is Catherine Gutierrez Schultz, and today I will be introducing another reason to be a member of CHCC. The CHCC endorsed health plans are minimum essential coverage, and when sponsored by a CHCC member employer, it does comply with the requirements of the California individual mandate, which did take effect again on January 1st in the state of California. They are designed to be small to mid-size employer friendly and are individual plans. You can offer these plans to your employees on an individual basis, or you can pay for some of it or none of it or all of it. This is our second webinar. The first focused exclusively on introducing the benefits and costs of the plans. Please note, last week's webinar PowerPoint is available for download on our website at chcchealth.net. We will also put today's on as well. As we go through these tough times for small businesses, we thought today we would look at how these plans can be used by our members to help your laid off or furloughed employees be able to continue to afford and actually use their health plan. These plans are described in greater detail on our website at chcchealth.net. We will review with you today on some of the plan options, and I can review with you in greater detail at another time about other plans that we do also offer. You can enroll and do everything online. If you are an organization that does need paper, we do have paper enrollments as well. I would also like to make everyone aware that with the COVID-19 testing, it is covered by our plans as a lab procedure. We are still learning more about this as we go, but the plans do offer the COVID testing. Also, the plans do offer free telemedicine, which right now is extremely important. As you know, if we have our children, somebody might get an ear infection, being able to just call and talk to your doctor over the phone or even a video chat can save you from having to actually go in and be around other people at the doctors right now. Okay, so with that, let's take a look at the health plans that are now offered as part of the CHCC membership and how they can be important as replacements for both COBRA and the marketplace. Next slide. So CHCC Healthcare Program, what we will cover today, we will do a brief overview of the program. We'll go into the eligible parties and the requirements to enroll. The ACA approved coverage, we will review that, as well as our minimum essential coverage plans, also known as MEC Plus. We also will review the Zion cost sharing, which is for catastrophic coverage. We will review COBRA and the transitioning that you can do for your employees. We'll review plan comparisons, and a summary. Next slide. Okay, so who is eligible to enroll? This unique benefit is only offered to your Hispanic Chamber CHCC members. So if you are a member of your local Hispanic Chamber or an affiliate of CHCC, you are able to take this plan and offer this to your employees. There is no other chamber in the state of California that is offering a program like this. So it is very unique, and it is only offered, again, to our CHCC members. There are no minimum employee requirements, so you do not have to jump through any hoops. A small family-owned business can get the coverage without having to meet any other participation requirements. Also, the employer does not have to contribute. You only have to opt in to offer it, but you are not obligated to actually pay for any of the cost of the plan. And this program is ACA compliant. It does meet the minimum essential coverage, and January 2020, we did bring the individual mandate back to the state of California. So it does meet those requirements as well. Next slide. What makes our program so unique? Let me start. It's designed to be flexible. The individuals, you can design your plan. You can pick and choose what you really want to make for a plan for yourself. So we do have 3 minimum essential coverage plans to choose from. They do offer no deductibles, low copays. You have a larger network, so it works as a PPO. There are also extensive ancillary services that are included. Those are Consumer Advocate. And Consumer Advocate is a program that is already into this plan, so it's not extra. And what they do is, if you receive a high bill, they come in and help negotiate it down on average 50%. They then will set up a payment plan for you if that is something that you need, and you won't keep receiving bills or collections. It will be taken care of on a payment plan should you need that. There's also, as I said, free telemedicine. So there's no deductible with that, no copay. You are able to just use the telemedicine at no charge. You can also email a specialist. So if you have a need and you don't want to go to the doctors right now, and it's something that a specialist, any specialist, we do have those consults online. We can get that for you, and you're able to email them and correspond and tell them what's going on, and you don't have to actually leave your home, and you don't have to pay a copay either. That is a free service, so that is wonderful to have included, as well as prescription coverage. That is included as well, and vision insurance, dental, hearing, chiropractic, and other alternative medicine. We have discounts for those services. Next slide. So here we show you what the minimum essential coverage plans actually have. We have 3 right here, as I said. There's the Choice Care Basic, and Choice Care Basic has, of course, preventative is at no cost. So as that's what makes it ACA compliant as well, is all the preventative services are at no cost. This plan for Choice Care Basic also does not include a deductible. There, you can go and see a doctor for $15, and you get 3 times per year. After that, you get discount to go to the doctors. So you would, and then as well as specialist urgent care, you would receive a discount versus a set copay to utilize those benefits. And you also, as I mentioned before, have that consumer advocate should you receive a higher bill that needs to be dwindled down, and also set up on a payment plan. As you'll see down below, you'll see the actual premium for that plan is $168. That is not age banded. So no matter what your age is, that is the premium. So mostly 45 and you're trying to get a decent plan, you're going to end up having maybe 400, 450 is what your plan is mostly going to be for a good plan. So that is the comparison. But the Choice Care Premium, that also has no cost for preventative. The deductible, there is none. Primary care visits are 15, and this is unlimited in this plan. So you can go to the doctors as many times as you need to in the year at $15. $15 only, no surprise or no discount, it's $15. Same with your specialist, $25 unlimited times that you need to go and see your specialist, as well as urgent care is also a $50 for unlimited. In some areas, I have gone to the urgent care twice myself through this plan, and I've only had to pay a $15 copay because the urgent care I selected charges doctor copays versus urgent care copays. I can help you find that in your area to save on that cost. Also, in both these plans, the prescriptions are $5 for generics. That is fantastic. As you see, mostly you're paying 10, 15. If you have a set copay, there's very rarely do you see a $5 copay on any kind of prescription. So that was definitely fantastic to have included. And then again, with that telemedicine, that is zero charge. You can do that unlimited times. And that member only monthly premium is $195. And then there's the Advantage Care, again, no cost. For the preventative, your deductible is none. This plan is a little bit more for the primary care visits. You get 20 for 3 times a year. Specialists are $50 at 3 times per year, and urgent care are at 53 times per year. After that, you do receive the discount and consumer advocate. One reason why this Advantage Care plan is a little bit more is because this plan actually holds MRI coverage. So you get an MRI coverage at a set copay versus the other 2 plans would be you would use a discount plus the consumer advocate. Okay, so again, down at the bottom, you see those plans. They're not age banded, no pre-existing restrictions. These are the premiums no matter your age. Again, with children, $290 for that plan, and same with your you and your spouse. I'm sorry, I had a question pop up and it was blocking my view. Alex, do we want to answer a question right now? I see there's 3 there.
Sure, yeah, if you want to go ahead. If you open up, you can see from Lisa, Emily, and Ernie are the 2 questions on there.
Okay, so for Lisa, if an employer has already laid off an employee, can they offer this plan to the employee? Yes, I will answer that soon, but I'll go ahead and do that now. Yes, so March, if you had laid off employees in March, you are able to offer this. You should have, of course, already sent out your COBRA if you had a plan in place. If you had nothing in place, of course, send this out to all of your employees that you've had to lay off to give them this alternative option. Okay, so from Emily Carlson, will testing for these COVID-19 antibody be covered? So it is covered, but at a lab and X-ray copay at $50. So it is covered at a $50 copay. And then for Ernie Flores, how about pre-existing conditions? So yes, so on these plans, the minimum essential coverage plans, we have no pre-existing conditions. So anybody can enroll into these plans, the minimum essential coverage plans. Okay, so we'll move on to the next slide. The second part that makes this program so unique, and as I said before, or as I did not mention before actually, is hospital coverage. You didn't hear me mention that at all. That is where this plan actually comes into effect. This is for your catastrophic, your possible hospital stay, emergency room, surgery. There are 3 plans to choose from. It's a medical cost sharing plan. You have no network. You can go anywhere in the United States and use this plan. And if you were to get into a car accident and maybe you broke your arm or your leg and you needed surgery, so that means you took an ambulance to the hospital, you went into the emergency room, but then you got admitted and you have surgery, and maybe you're in the hospital a week from that surgery. That could be quite a large bill. With Zion, however, there are 3 initial and shareable amounts to choose from. We know those as deductibles in the traditional insurance, but here with Zion, they call it an initial and shareable amount. And what you do is if you chose the 1,000, you would pay that first 1,000 for that terrible car accident that you may have been in and needed that surgery. So you pay that 1,000. Zion pays for everything else. Everything else, even if you needed physical therapy for that, whether it lasted a year or 2 years or 3 years, that physical therapy, they would still pay for it. They still would not charge you any more than that 1,000. So in this regard, for that need, it does not restart like a deductible does at the year. So you do have those 3 times per year. Should you have a 4th catastrophic event, Zion does pay for everything. It's very, very, very rare that anybody would have probably more than 2 catastrophic events. There is a pre-existing, however, with Zion. Zion does have a pre-existing look back of 2 years. Okay, so there is that for some people that may have had some serious diagnosis. This is not for maybe you're an asthmatic, but if it's something like maybe you've had cancer in the past 2 years, or you've had treatment the past 2 years for that cancer, that would be something that they would exclude for the first year of your plan. That doesn't mean if you got in a car accident, they would not pay for that service though, but it's anything to that pre-existing condition. Okay. Next slide. So here I'm going to show I know it's really small print, but this is the Choice Care Basic with Zion. So what we're doing here is adding the minimum essential coverage plan, the Choice Care Basic in this case, with Zion cost sharing. And Zion cost sharing has those 3 initial and shareable amounts that you can choose from. And that is 1,000, 2,500, or 5,000. The Zion cost sharing plan is divided by a set age group of 18 to 29, 30 to 49, and 50 to 64. The premiums that you see here have already included the Choice Care Basic plan that you saw on a few slides before. Okay, so should you want the Choice Care Basic plan that has $15 copays for 3 times, and then if you had a catastrophic event, you pay that 1,000, and then of course Zion pays the rest. If you were ages between 30 to 49, your premium would be $345. Okay, again, if you chose the 2,500 plan, your premium between 30 to 49 would be $315. Same with if you chose the Zion, the 5,000, it'd be $295 from the ages of 30 to 49. Okay, so these premiums alone show you how much you can save just monthly on health insurance alone. So that is something definitely to consider, and we can go into greater detail offline as well into your plans. Next slide. So just some quick facts that we have found about COVID-19 and the California economy. More than 2 million of our Californians have been laid off already due to COVID-19. So as I mentioned before, we are able to offer this program to those employees who have been affected by this as even back in March. So if you have not previously opted in and you decide to opt in today or next week, you're able to still offer this program to your employees that you've already had to let go back in March. And the soonest effective date would be 5/1. And California is, I've read California is facing 2 years of high unemployment from this. So having these plans for your laid off employees or furloughed employees during this time can be extremely beneficial, as rent is due and car payments are due and nothing is stopping. And of course, our health insurance is also very expensive. So having these plans in place or just offering it to those employees may just help them alleviate some of that financial burden. Next slide. Okay, so now I'm going to dive into COBRA. So what is COBRA and CalCOBRA? So COBRA, the federal COBRA, is the law that allows you to keep your group plan when you end your job. So that means you're keeping that plan that you had. So if your employer only offered a gold plan, you would have to take that gold plan if you accepted COBRA at the end of your job. It also requires it to continue for any spouses or other dependents that have been on the plan. That is for the first 18 months. And then you have CalCOBRA that you can also continue on to. And then for just CalCOBRA, if you are 2 to 19 employees, CalCOBRA offers just the same as federal COBRA in that it's an 18-month extension to what you had as with employment. However, I will add that it is the full cost of the premium plus 2%. So that premium actually goes up even more than what it actually was when employed. And that is due to the admin fees that are put on that. Next slide. So just here is a chart for 2 to 19 employees, CalCOBRA can go up to 36 months. And then for 20 or more employees, you have 18 to 36 months if you choose the CalCOBRA after you end federal COBRA. Next slide. Okay, so offering this program can truly be a lifeline you give your laid off employees. The cost, and I'll get into that on the next slide, is the savings that you can offer them one last time. You know, it's almost like a gift you're able to give them because of the cost savings that they're going to have. And so next slide. So as I said, yes, it's a lifeline that you're able to give your laid off and furloughed employees. This plan can truly save you up to 70% off of COBRA and Covered California plans. As we know, Covered California did open up, but just because you were laid off doesn't mean you're going to get the subsidies. You would think maybe you would, but unfortunately, that's not always going to be the case. And if you do find another job and make money throughout the year, and if you don't notify Covered California of any of that, it will be trued up at the end of your taxes for next year. So that is also something to consider. So, and also, as I stated before, remember that the COBRA employee does pay that full current premium plus the 2% admin fees. So for an example, last summer, I actually left my agency that I worked for. My COBRA was $968 for myself and my 2 children. I now pay $290 for myself and my 2 children. And the amount of savings just alone on that is just fantastic. So as you see here too, if there's a family, right, with a COBRA premium up to about $1,800 that's a bronze plan. That's going to be your basic plan. And you can see still the savings by going to a choice care plan with a Zion 1000. You can see there's such significant savings, and you don't have that large $6,300 deductible, which I'll get into in a couple more slides. But there is a huge significant savings, not only monthly that you will have, but every time you go to the doctors, which is extremely important right now. I feel like more than ever, we're all trying to save as much as we can. Okay, next slide. I think I have several questions coming up. We're going to take a moment and answer some.
Hey, Catherine, sure. So let me start with Sandra's right there. Is the Zion plan like a high deductible plan is her question.
No, it's not like a high deductible plan because you have, well, let me think about that. I guess it really depends on what you mean by that, but it's not an HSA plan, okay? So you can't have that with it. It is $1,000, $2,500, or $5,000 for a deductible. So the $1,000, I would not consider that as a high deductible plan. That's quite low. If you chose a $5,000, that would be comparable with maybe the $6,300 bronze plan that's out there. That is a high deductible plan. So I would say if you look at the $5,000, that would be more of a high deductible. But remember, that's only going to be for your hospital coverage. So that's not going to be for your doctor's visits. You're going to have set copays for your doctor's visits. So it's only going to be if you ever have to go to the hospital. Okay, so that is a big difference of the two for sure.
There was another one. I think Carlos typed it in the chat there. Catherine, let me see if I can pull it up. Okay, here we go, from Carlos Mendoza. He's asking if you said if a small business can pay all the costs of its employees or only a portion. For the latter, does an employee pay their premium directly to you or to?
So all of the above. You can pay, the employee can pay directly online if you don't contribute at all, or if you did want to contribute some or all of it, it's completely up to you. So being able to offer this no contribution is what it was designed for, but you can absolutely contribute just as if you were doing so in your traditional market plan. Okay, and we can help you if you have, several employees, and we can help you with the payroll offline and try to figure that out for you.
Okay, that's all the questions I had for you, Catherine. If you'd like to continue.
Great. All right. So the future, traditional insurance, as I've said, is expensive. Okay. We have mostly high deductibles for actual affordable plans. If you're looking at maybe your insurance plan, can your employees actually use it? Do you have that high deductible plan that has no first dollar coverage? Or do you have a plan that you do have some first dollar coverage, but it still has higher deductibles or prescription coverage deductibles? This plan does not have prescription coverage deductibles, as there are plenty of those out there. So you want to be careful as well when you are looking out there in the traditional market. So to compare that just briefly on our plan, see, you can pay 0 to 100% of the plan, like I just mentioned, and this is the Med Plus, or you can upgrade to the Zion. We do have standalone benefits offered for dental and vision and travel insurance, but dental, vision, and consumer advocate is included in the Med Plus plan. But if you wanted separate dental coverage, you can certainly do that in the standalone. And this program is truly just for you to design a healthcare package that makes sense for you and your business and your employees. Next slide. Okay, this is my favorite slide. This really shows you what I've been talking about as far as high deductible plans. So here in the traditional market, you have the bronze EPO, okay? You'll see this is compared to our Choice Care Premium plan. The traditional market bronze EPO plan has a yearly deductible of $6,300. If you have a family, that's going to be $12,600. It also has that separate drug deductible that I just mentioned. And this separate drug deductible is $500, okay? In comparison to the Choice Care Premium that has, as I said, 0 deductible, and there are no separate drug deductible either. Then if you look down at the network, this bronze EPO plan is actually here in my area of San Joaquin Valley. So, and then it has my zip code of 95219. So I can certainly research this in each of your areas. This one just pertains to my local area. And as you can see in the traditional market bronze plan, there's only about 131 doctors that were included in that network. Whereas in our Choice Care Premium plan, there is a substantial more. There's 594 doctors available. And with the hospitals, there's only one included, and that would be Dameron here in our area. With Choice Care Premium, we have both St. Joe's and Dameron. And with the Zion, though, and I'm not sure if I mentioned this, Zion has no network. You can go anywhere in the United States. So if you really wanted to see that specialist in New York, you could go to New York and see that specialist. Or maybe you needed to go to the Mayo Clinic. You could hop on over and go to the Mayo Clinic. There is no network, okay? So, and again, you're only paying for that initial unshareable amount for that need of the reason why you have to go to that doctor or facility in another state. Or maybe within your state and you want to go down to UCLA or Stanford or something like that, okay? And so here below, it's the primary care doctor visits are $65, okay? And then the Choice Care Premium plans are $15. Specialists are $95. Choice Care Premium is $25. The urgent care is $65. And the Choice Care Premium is $50. And as I mentioned before, and some urgent cares in certain areas are actually only charging the $15 copay instead of the $50 urgent care. So I can help you find an urgent care in your area that does that. But the significant savings just right there is a lot, just by going to the doctor. So next slide. This gives you the breakdown of what it actually cost. So what we did was we went on to Cover California, and we entered a single 36-year-old that makes $33,000 a year. We wanted to know what their subsidy would be given compared to what our plan is. So as you can see, the subsidy that they were given is $127.37 as with their income at $33,000. Makes their monthly premium $278.20. Remember, this is the bronze plan, the bronze $6,300 plan of a high deductible, whereas the Choice Care Premium, remember, does not have a deductible and has the set copays. So, and that's $195. So it's considerably less than that $278.20. If you are that 36-year-old that makes $45,000, you no longer get a subsidy. So you're paying that full cost of $405.57. Whereas again, the monthly premium would be $195 in the Choice Care Premium plan. Going down below to that family that makes $100,000 a year is paying, or is only getting a subsidy of $82.60. So if you can see the fraction of the cost down there, so their premium is $1,700 versus $385 in the Choice Care Premium plan. Again, that deductible for that family is $12,600. Okay. The savings that they will have monthly, they could put towards that large deductible should they actually need it even, right? I mean, that is a huge savings monthly for them. So I get real excited about that actually. Okay, so next slide. This shows you the same as before, but with the Choice Care Premium plan and the Zion 2500 initial unshareable amount. So as you can see, for that single 36-year-old that makes $33,000 a year, their premium is $278.20, and in the Choice Care Premium plan, it's $297. So it's about $19 difference. However, you have set copays and no large deductible. So it might outweigh if you are somebody who wants to make sure you're able to actually use your benefits when you go to the doctor. Okay, and so if you go down to that family that makes $100,000 and only gets $82 in subsidies, you see they're saving almost $1,000 choosing the Choice Care Premium plan with Zion 2500 versus $1,700 for that, again, large $6,300 deductible, which would actually be $12,600 for the family. So, I mean, the significant savings right there should just make you excited and want to offer it. So moving on to the next plan. Okay, so this plan is a gold, okay? And this I feel like is a really good comparison because you don't have a deductible in the gold and you don't have a separate deductible in the gold. And in the premium, we don't either. But with the network, you still see Choice Care Premium still has more doctors than that gold EPO plan. If you go down to the benefits, that gold EPO plan is still $15 more to see the doctor, and still $65 versus $25 to see the specialist. So the savings, comparing this to a gold plan, you can just see by going to the doctors. And I'll tell you, I had a gold plan, and when I switched to the Choice Care Premium plan, I paid $50 before to take my daughter to the doctors and to get a prescription filled. Now I paid $20 in February because I have the Choice Care Premium plan. I only paid $15 to see the doctor and $5 for her prescription. So being able to save not only monthly, but when I go to the doctors is just huge. So think about that as well as you are reviewing these plans. And next slide. Okay, so this slide shows you the gold EPO and what you would get at, again, the same ages and income amounts as before. So that 36-year-old that makes $33,000 and wants that gold plan so that they can have first dollar coverage, look how much they're going to have to pay. $543 just to have first dollar coverage. Well, where first is Choice Care Premium, where it's $195, right, for that first dollar coverage. So again, down at the bottom, this is where it gets really interesting. And I should say, you know, when you leave your job, you're not able to choose a different plan. So if your employer only offered a gold plan, that is the plan that you have to take if you want to take COBRA. Okay, so down at the bottom, you can see if we add that 8260 back into that 2800, you know, the significant savings, right, between the Choice Care Premium and that plan is just so much. It's a fraction of the cost. So if you were somebody who did only offer a really great plan, and maybe you paid 100% for your employees, which is fantastic, and now you're unable to do so, that financial burden of the COBRA because of that only having that gold plan offered to them could be substantial. And so by offering this Choice Care Premium as just an alternative option, you know, could really help them save tremendously. And if we go to the next slide, it can show you with the Zion. So if you go down the bottom for that family, I mean, you're still saving $2,000, you know, adding that Zion. That's monthly. So put that $2,000 just in case you get that, you know, get into that catastrophic event. Okay, so the amount of savings that you'll see in this plan is just remarkable. And I encourage you all to look at your current coverage, or if you are looking at in your market right now, let me know. I would love to help you compare what you have or what you are looking for to just see if this is going to be a good fit for you and your organization, as I think the numbers do really speak for themselves. Okay, next slide. So in summary, this is only exclusive to our CHCC members. It does comply with the California individual mandate, and this is not required for an employer to financially have to participate. You only have to sign a form that you opt in. And that is so we can send that to the IRS so that they know that you all had health coverage as January 2020. That, of course, went into effect again. And we reviewed what this can do for your employees that you've already had to let go. So again, if you've had to let go of employees back in March, I know dealerships in our area have had to let go right away as the GM factories had closed. You know, I know that they had layoffs right away in some of the departments. So, we're experiencing that all around, and just being able to offer this to those employees who are in a financial burden and stress right now can just mean so much to them. So if you guys have any questions, I can answer them now, or we can speak offline as well. And next page. Okay. I think I have some questions down here. I'll go ahead.
Yeah, Catherine, just so I'll go through because I know some of them were in the chat, some of them were in the Q&A. Carlos, in the Q&A there, is there an age minimum for an infant/baby for them to be included in the family plan?
No, not at all. 0 to 26, actually, I should include. So they are all, so if you had the Choice Care Premium Plan, for instance, is $290 for the just an employees or member, just say myself and my 2 children. If I had 5 children, it would still be $290, and it doesn't matter what their age is between 0 and 26.
Okay, and Catherine, if you can open up the Q&A tab there, I just want to see. Ernie has a pretty long one there. Ernie, we're going to get to yours, but while we're getting ready for that, Sandra did ask, could this be offered to businesses who haven't laid off employees but don't offer health coverage?
Oh, absolutely. Yes, absolutely. So this is for any member of your local Hispanic chamber that's a member of CHCC or an affiliate chamber. So yes, you can offer this to any employer, any individual self-employed person who maybe has just a family-owned business. There's 2 or 3 of you, and you're all family, and you don't meet that small business requirement to get a health plan. So yes. Doesn't matter the size.
Okay, and I'm just going to hit Victoria's really quick, just so you'll have some time to read Ernie's. What is the turnaround time to get started? Like if my employee signs up today, would the coverage start immediately, or would it be the first of the month?
Yes, so if you started today, it would be effective May 1st, and you have until April 30th to make it effective on May 1st. Same through May 31st, it would be effective June 1st, and so on. So there is no true open enrollment time. You can come into this program at any time during the year. So if you wanted to, maybe your current plan that you have right now doesn't renew until November. That doesn't mean you have to stay in that current plan if you did not want to. In other words, you can join this plan anytime.
Katie, if you see Ernie's question there, it's a pretty long one. I don't know if this might be something you might have an offline conversation with him, but if you can check that out in the Q&A. I know there's some in the chat here. Let me pull up. Oh, Elizabeth, she asked, is there a plan for employee and children? I think you already touched on that.
Mm-hmm.
Okay. Do you see Ernie's question there, Catherine?
I think the overall statement would be he asked too good to be true, and it is. It's a fantastic plan. I know it sounds too good to be true, but it's wonderful. It's a wonderful plan, and I know that we can talk offline too about your premium that you currently pay and what it could be by switching off of your Anthem plan, and we can talk about that offline.
Yeah, and if you look, folks, if you look right there, we have Catherine's contact there, her phone number with the extension 708, and her email, kgs@apogeehealth.solutions. So if you ever need to get a hold of her, please put it in there. I think another question just came in. Oh, that's Ernie, perfect. Okay, Catherine, anything you'd like to close out with?
Well, again, that I can compare it to your current plan or a plan that you're looking at, or I can help you find and make sure maybe a doctor's included or a prescription's included, anything. Just give me a call. I'd be happy to speak with you and look into this plan further. And we also have a lot more on our website. So go to chcchealth.net and you will find other great programs as well, like travel insurance. Of course, right now, I guess we're not traveling too much, but there is that for I guess when that does open up again. And then we do have just other, it explains Consumer Advocate in greater detail, and it just gives a lot more resources. But if you ever have questions, please contact me, email, or call me anytime. Thank
Catherine,
you, guys.
we had one more question there from Carlos. If I call my current provider to see if this plan is covered, would it be called Choice Care Plan? Would they know? So I guess you want to speak to that.
Sure. You would it'd be Choice Care. You would say Choice Care or Advantage Care, but you would also want to probably look at the First Health Network, which is and that's located on our website. But if you have a specific doctor that you would like me to look into, I can certainly do that for you. You can give me an email and I can research that for you.
I don't see any more questions in the Q&A or the chat. So Catherine, thank you again. And folks, if you want to get a hold of her, please right there, or you can contact us at the office. My email is alex@cahcc.com. And of course, our phone number is 916-444-2221. I'm gonna put that in the chat right now. Thank you again. I see if Julian's still with us. If he has to say anything, he might have already logged out right now. Yeah, I think Julian's already been leaving, but anyways, thank you all for joining us. Thank you, Catherine. And if you have any, there's Julian.
No, just thank you, Catherine, and everybody. If you're interested, please connect with Catherine or Alex. And this is, like I said, this is a program that was designed for our chambers and for your members directly. And so it's pretty exclusive to that group. So anyway, we hope that you'll take advantage of the program. Your employers and your members will take advantage as well. So thank you for joining us today.
Thank you all. Have a good day.